change permeability of the vessels, the erythrocytes cannot go out, but fluids can go out, and this is fluids start accumulate into the outside, into the interstitial tissue. But in this case, the alveoli, it's place for the change. The same change can be found in liver. Few slides today. Also, can be found hemorrhages in liver. Maybe severe dystrophy, it's more in case of the dystrophy, necrosis, progression, hemosiderosis in case of chronic, because need time for this change development. In case of acute, the hemorrhages can be development, edema into the sinusoids, accumulation, the expanded and hyperemia sinusoid with the change area of the hemorrhages. So, it's clear about chronic venous congestion. In case of chronic, this is change developed not quickly, the slowly progression, and those every time. In case of chronic condition, morphological change is more severe, because this is change developed long time, and atrophy it's a result of long term. It cannot be today patient has big heart and tomorrow has small heart. It's not impossible. It should be long time for decrease size or increase size also. Those in venous hyperemia, chronic venous condition, and also together with the progression morphological change, sometimes the organism, the body, try to compensate any pathology we develop inside of the organ, try to return function, and try to do something. It can be bad sometimes, but try to do something. Not fail. Try to do everything. Those. What change can be found into the vessels and into the surrounding tissue during chronic venous congestion? This is process developed long time, slowly. Rupture of the vessels not developed due to chronic venous congestion, but permeability of the vessels change, of course. Hypoxia. The hypoxia. Those, the primary fluids go out, but blood continue accumulate. Primary fluids go out, then next step, plasma proteins start go out also. Plasma proteins. And due to outside plasma proteins, what change start into the interstitial tissue?
Changes in output
This is inside of the blood, but I ask about the interstitial tissue.
Fluids.
Plasma proteins start accumulate. What? Dystrophy. Mesenchymal, coil swelling, fibrinoid swelling, chylinosis, sclerosis. Into the alveolar walls and start progress fibrosis. Process will progress. Those, next. If permeability of the vessels continue increase, the erythrocytes also can go out. When erythrocytes go out from the vessels, erythrocytes die. And
Microprep
and those, this is microphage can engulf, this is. And name of this is pigment. alveoli connect with the bronchus and into the sputum. The patient who has problems, long-time problems into the heart, can be found at microphage within hemosiderine. This is cells called arterial cells. This is questions what into them. When you will prepare a lecture on the two sides, you can find this is picture. The greenish type of the lecture. Those, the progression, micro, the red blood cells outside, microhemorrhages. Also, what is the name type hemorrhage if hemorrhage happens without rupture of the vessels? When erythrocytes go out due to hypermobility of the vessels. Diabetic hemorrhage. Diabetes of the erythrocytes happen, diabetic hemorrhage. When the vessels, it's hemorrhage, micro hemorrhage, but without rupture of the vessels. Nose, transudate, hemosiderine, and the enlarged capillaries with arterial walls, which we discussed. If this is change progress, the scarring starts scarring around the vessels, perivascular sclerosis start, but if process, thickness of the vessels wall become high venosis of the vessels. If process progression, diffuse pneumosclerosis with a diffuse pneumofibrosis happen. This is change progress. And those name of this is change. What is the name? This is change in lungs. Round lung induration. Round because hemosiderosis. Induration because
So I know the consideration of the spleen, those. There a lot there written. No, written back. The reduction of white pulp, the parenchyma, this is normal structure of the spleen, decrease, and a lot of stroma. All of them, it's stroma. Not my cleaver. Those, pay attention to more whitish area. It's necrosis, it's dystrophy and necrosis central lobular hepatocytes. This is part peripheral hepatocytes. And if you pay attention, use large magnification, you can find the drops of fats in peripheral hepatocytes. This is central vein, dystrophy, central lobular hepatocytes, necrosis, this is hemosiderosis, and this is more peripheral areas.
Peripheral areas.
Areas. No, it's the same. Brown lung induration, hemosiderosis, maybe induration, no. Who has other?
Any pictures?
You have a brown induration.
Yeah. The same thing I think is it this.
No. Maybe somebody have their induration from the class 3 class, from the third class. Maybe with some difference. Now lung induration. This is same slide at exam. A lot hemosiderine, brownish color, and progressive connective tissue growth in this area. The thick alveolar wall becomes thick, and reduction of alveolar space. And those, if this is process progress, the complete pneumosclerosis happened. spleen. Again, cyanotic induration of the spleen. Central part of hemorrhage should be the areas where are hemorrhages and brain. It's also brain, it's hemorrhages. Again, the central part of the hemorrhage, the hemorrhages.
In this one, these are the fat, right? The yellow color one.
No, it's hemosiderin. Fat without color, colorless. In hematoxylin fat colorless. The drops inside of the hepatocytes. The small empty drops without color. No, this is picture that show the area. Your more severe change, more intensivity, and this is less intensivity. Hemosiderin, more brownish color, more whitish. It's atrophy and necrosis central lobular part. And the peripheral hepatocytes maybe try to find some fatty change. Hepatic lobula, congested central vein, hepatic sinusoids, atrophy central hepatocytes, necrosis, then fatty middle part, and normal peripheral hepatocytes with a minimal change, and this is part of the hepatocytes can later regenerate.
This is where we can see the hemorrhage. This.
No, this is double layer of hemorrhage. In all area hemorrhages. Oh, this is brain. This is area of the hemorrhage. What is it?
Stays.
Blood full vessels. All of these orange spots is blood full vessels.
Orange spot blood.
No, it is. Orange because it's erythrocytes, orange color. Reddish orange.
What is this?
No, this is white pulp. This is lymphoid follicles of the spleen. But to compare it with normal, the spleen should be bluish color and not few amount of reddish. But in this case, the opposite variant.
So
A lot stroma and few amount of parenchyma.
So doctor, the purple color is white pulp,
Da.
and this one is okay.
It's red pulp. This is vessels. Pay attention to thick vascular walls. Not McLeod.
Doctor, what is this?
This is central veins. This is central vein. This is central veins. This is areas necrosis of the atrophy hepatocyte. This is brownish hemosiderin. And this is area more peripheral, near the triads. This is peripheral area. This is also triads. The more peripheral area of the hepatocyte. And those, if you maybe pay attention, you can find vacuoles of fats dystrophy inside of the hepatocyte.
So this is the fatty part.
No, this is change with fatty change. Can be found at fatty change. No, it's also hemosiderin, hemosiderin, hemosiderin. No, fatty change. This is maybe fatty change vacuoles inside of the hepatocytes.
So doctor, in this slide, the white thing is the fat.
Not. This is why this is necrosis. The hepatocytes atrophied and necrotic change.
These white ones are fat.
This is fat.
The inside white.
The inside of the hepatocytes should be.
Doctor, is this the blood vessel?
The blood vessels. All of this is blood vessels. Very long, very big blood vessels.
So doctor, this is the
Second blood vessels.
space. These are the alveolar space. And after these things,
This is alveolar walls. Hemosiderosis start, but in duration, not severe in this
doctor,
slide.
can we see the thick alveolar septa? They said.
In this slide, not.
This also no. Doctor, in this, which ones?
Hemorrhage. All of this area hemorrhage. This brain. This is hemorrhage. This is brain also. Part of the brain. Piece of the
Brown
brain.
color area is hemorrhage.
Yeah, and then this light
This
color one
is
is.
this is brain.
Brain.
This is brain. Next. This is brain. This is brain. This is hemorrhage.
Doctor, these are the blood vessels.
Blood vessels in area of the hemorrhage. It's pia mater hemorrhage. This is blood vessels in pia mater. Stasis. Yeah, they're good stasis. Very good stasis.
Doctor, what are the dot pink?
What pink you
This
mean?
purple color dot. Nucleus.
No idea. Of course, the nucleus.
And after
The neurons nucleus.
this one, the blood.
The blood vessels. The blood vessels completely filled.